Welcome to the Ashi Acupuncture podcast, sharing real techniques so you get real results. Here's your host, Eric Shanky.
Hello, listeners. Welcome to another episode of the Ashi Acupuncture podcast. Today, I'm happy to have on Adamczyk from New Jersey. AJ's a successful acupuncturist out back east, and he uses a lot of electroacupuncture. I'm hoping he can teach us some of the basics of electroacupuncture to help us help our patients more. Welcome aboard, AJ.
Thank you, Eric. Great to be with you today. Yeah,
glad to have you on. First off, do you like to call it electroacupuncture or electric stimulation, or what? I note it as e-stim when I'm charting. What do you do?
Yeah, I typically use e-stim. Acupuncture is the name, but I mean, it definitely is used differently throughout different textbooks or different people that use it more or less. But e-stim, electrical acupuncture, electrical stimulation acupuncture, or stim acupuncture, there's all different names. But, you know, it's all the same. It's not like it's really that much of there's no difference in there. It's just the name.
Yeah, right. What do you use electroacupuncture on a big percentage of patients? Like what what percentage of patients do you use it on?
It really varies from client to client. And typically when, say, a client comes in a major spasm, say like a low back or a sciatic type pain, I will, usually that first day I won't use it. I'll typically see how the client reacts to just needles. But usually from that second to, say, 7th or 8th session, depending on like if the person sticks with it, I will use it, and I will have a protocol that I'll run through. And so it's all relative to the patient. And that week I might see, say I see 60 people in a week. Mm-hmm. You know, half of them might be for sciatic pain that I use, you know, the e-stim protocol on. Vice versa, you know, one week I might not have many that call for it. So that being said, I can't give you an exact number percentage-wise, but I'd say I use on a daily basis, say I see 15 people, I'll use the e-stim unit maybe 5 to 10 times.
Okay, that's a good answer. So when you said that if the patient comes in with a bad back spasm, do you mean like a real acute case, like, oh, this happened yesterday or something like that? Not like,
yeah, Eric,
2 months, is that?
Exactly, Eric. So I live in New Jersey, and I don't know if you know this, but we've been getting crushed by snow over here. People have been coming in with, you know, the shoveling back pain, shoveling snow back pain, like left and right. So, you know, you can make a living over here in New Jersey just treating snow shoveling back pain.
Yeah, you gotta write up a case study, snow blower's back.
Yeah, right. Snow shoveler's back. That'd be a good one. So, so I've been seeing a lot of that lately. So, and also to the, adding the stim in there, it just enhances the treatment.
Yeah. So when would you decide, like, if it's really acute, you'll tend to lean away from doing e-stim at first, but if it's a chronic case, if it's been going on for 2 months or 2 years, would you consider it as a first treatment, or would you just never consider it as a first treatment?
No, I will consider it a first treatment, but depending on the person too. I know you're not very into the whole, you know, person per se, like the element side, the meridian side of stuff, but I do take into effect if a person is more on the yin and yang type of person and, you know, feeble versus a stronger person. You know, if I do have an elderly person come in that's low back pain, you know, I will start thinking more on the kidney side than on the musculoskeletal side of things. So, you know, kidney yin deficiency. So it's all relative to how I'm, you know, that person that walks through the door. It's case by case, really, Eric, you know?
Yeah, that makes sense. I tend to use e-stim if I have a stubborn case, and most of the cases I see, I do a lot of needle top moxa. So if I see a case and they're a stubborn case, they're not responding to needle top moxa, then I'll consider e-stim. And the two areas I generally use it on are the upper trapezius and the the glute muscles. Those are the two areas I tend to use it the most. Sometimes it's some of the paraspinals on the thoracic spine. Are there certain areas you tend to use it more than others?
Yeah, I tend to use it on the shoulder a lot, and obviously the hips, the low back. The biggest area I use it on is that lumbar spine for sure, though. The lumbar spine.
On the paraspinals, right? Not you're not talking about the glutes, but the paraspinals.
I'll use it on, like, literally in the vertebrae. The Wato Jajis.
Oh, I got you. Yeah.
I'll drop into the Wato Jajis, and at the same time, I will usually do like the negative, or like it's called a motor point at, like, say like a GB30 in the glute. So that will be my motor point on both sides. So if I have, say, 2 needles in at L4, L5 or L3, L4, I'll clip those together, and then I'll drop my motor point on the GB30 as my glute. And then I'll sometimes drop one further down the leg. If the person has lower leg pain, I'll either go down as far as like along into the IT band, into Ashi points, and then as far down as into the glute or into the calf muscle.
I got you. When you say, like, if you had a JJ L4 and a JJ L5 and you put them together, do you just like physically bend the needles together and then clip them together? Is that how you do it?
That's it. So you kind of do that little cross action. Obviously, at that point, you obviously want to use a little bit longer of a needle so that needle doesn't get bent too much or lose the depth of really where you're trying to be with it and the bottom. So you don't want to pull it so much that it's actually changing direction down within that vertebrae. So that being said, is you want to use longer needles, and don't be afraid to use long needles on the vertebrae. Yeah. I know a lot of people are scared of using them and using needles at depths they really don't want to, and vice versa. Yeah. The body is a lot stronger than you think, and you're going to feel if you're going to hit something, it's going to stop you. These needles, it's not like we're using daggers or something. The body's going to stop you.
I've been accused of using railroad spikes before.
I know, like the 32s, the 30 gauge, like 3 inchers.
That's good advice, though, where you make sure you use a long enough needle, because ahead of time that you're gonna bend them and tie them together with the alligator clip. So yeah, you want to make sure you've got enough room to play with.
Yeah. And also another huge tip that I've seen, contraindicated around within the East Stim world, is that, you really never want to cross the midline.
Oh.
You never want to cross the midline because it can send someone into seizures. But they say that depending on who you follow and what guy, Harrison Gelman, or different people within the business that say this is the protocol, definitely nowhere near the neck. Never cross the midline around the neck. Below the thoracic, I've even seen don't do it. I will at right at the bottom around the L5 sometimes I'll throw a pair cross, but that's the only time I'll ever cross is at the L5 line. I'll never cross even above that.
Okay. Another good tip. Yeah. That's a common thing. Don't cross the midline. I've seen that. Is some of the warnings we get in acupuncture, you wonder where they come from. In this case, maybe it's kind of obvious. You don't want to send someone into a seizure, but I've seen too, when I first started to study with my mentor, I saw him doing LI4 on a pregnant woman and spleen 6. And I was like, oh my gosh, in school it said to, never.
Yeah, I would have freaked out too. I would have totally freaked out.
And he was like, have you ever tried to induce a woman into labor? It's really hard. Even if you give it your all. I guess opinion, success rate is about 50% if you just really try to.
I guess so. But at that point, it's like, you're messing with a baby, and it's like, you don't really want to mess with.
Yeah, listeners, here's my legal disclaimer. This is for informational purposes only. We're just chatting about this stuff. we would never do these things in our clinic. So there we go. I hope the legal team is satisfied with that.
There you go, Eric.
Do you only use e-stim for pain? Is there another case where you'd consider using e-stim?
Although my major thing that I work on is pain, probably 90% of my clients are for pain. Typically, I'll even have a person that I am treating for pain and they say, oh, well, my stomach's bothering me today. Or, I have a client and say, well, my wife is looking to get pregnant, blah, blah. And I've helped maybe, 2 handfuls of women and, husband, wife conceive. And within the infertility, you can do e-stim at different protocols along different points to help bring blood flow to, say, the female reproductive organs and stuff like that. And then also, too, on the digestive side, so you can e-stim on stomach 25, or stomach 36, spleen 9 for, say, someone who's constipated or diarrhea that has a digestive issue.
Oh, that sounds like another good podcast topic about the infertility, e-stim for infertility. So I'm going to leave that now. It'll be a good teaser for the listeners. All
right. Sounds good.
Can you, different books will talk about different frequencies, can you talk about the different frequencies that you use? And is there a general area, the higher frequencies are more for this and the lower frequencies more for that? Could you?
Yeah, for sure. So, typically, the first treatment, I'm always going to be sitting in the 2 to 5 hertz range. And what those do is, what these different hertz is produce different endorphins. So from 2 to 5 or 2 to 4, it produces opioids in the range of encephaline, endorphin, p-endorphin, dynorphine, and endorphamine, and different things like that. But as you go higher, around the 10 hertz, it gets substance P, and then you'll get even higher. You'll get CCK8 around the 100 mark, 100 hertz. There's all different opiates, and what these things do is they literally are an anesthesia within the body and can create on that sensory, somatic nervous system, and it can release different opiates and really bring your body into relieving pain.
Wow, thanks for explaining that. I've never heard someone put it so simply. That was a big help for me to learn that. I hope the listeners got something out of that.
So no one's really realizes that. Everyone thinks it's the same type of e-stim as when a physical therapist or a chiropractor puts the TENS unit on their body. Right. That's TENS. That's getting put on your surface. So that's just surface irritation. And they try to compare it to this, and this is nowhere near what that is. It's not even in the same ballpark. It's like saying Little League versus the major leagues. And the PENS unit, which e-stim acupuncture is PENS, percutaneous nerve stimulation, it's like playing in the major leagues. The TENS unit that the chiropractors and physical therapists use, that's Little League. And that being said, it's just totally different. We're not just irritating the skin to then have a thought that, oh, my muscle feels better. It's totally different. This is a long-term effect of opiates and chemical releasing in the bloodstream and stuff like that.
Yeah, I agree 100%. I've seen so many cases where patients have chronic pain and they're actually issued a TENS unit, and they've used it a lot, and they get maybe a little bit of relief from that. But when you do electroacupuncture, it's like night and day. That's a good way to put it. The kiddie league and the major leagues, it's a good way to put it, because in my experience, it is absolutely true. There's so many cases that TENS won't do diddly squat, and you do electroacupuncture, and it's big relief for the patient.
Thank you for listening. Watch for Eric's book on advanced Ashi acupuncture techniques. Don't miss being notified of its release date and when the latest blogs on useful clinical tips and techniques are posted. Stay informed and up to date by signing up now at our website, ashi-acupuncture.com. Now back to the program.
Now, I've heard mention, and a lot of these terms I don't really know that well, but I've heard there's different shapes to the wave, that you can do like a square wave, or I don't know if it's a peaked wave or a sine wave.
All right, so
can you comment on that at all?
I'm not hugely I'm not going to sit here and tell you like I know exactly and that this is what this is. But from my understanding of what it is you think about like you see a wave and it has that highest peak, or it's like 1, 2, 3, 4, 1, 2, 3, 4. It's kind of that rhythm. Mm-hmm. So you think about it when the needle, the clips are on the needle. So you're going to get that. It's not a just continuous muscle. It's more of a. So it's the fact that how fast it's going to be coming in, or vice versa, slowly it's coming into shocking that needle. And is
that kind of like that? You can have a continuous, where it's like, I forget what they call it, tetany or something, where it's just like. Zzz,
yes.
There's like a pulse one, and then
intermittent.
Then there's intermittent. Maybe do you use those different?
So intermittent has been proven to help pain the most. And they've done studies that continuous actually can cause has not been very successful. But the weird part about it is that I use mostly continuous and I see results with it. I'm just telling you what the textbooks and what things say is that intermittent gets the best results. But in my clinic, I get the best results with a Pantheon research unit. And I do use continuous a lot. I do both, but at the same time, that being said, I do use continuous a lot.
Okay, yeah. Thanks for sharing.
Going against the grain. Going right against the grain.
Thanks for sharing your personal insights. You mentioned PENS before. That's percutaneous nerve stimulation. Now, is that the only? When you see a patient, are they going to get PENS no matter what? Or could you review what PENS is versus what other types of electroacupuncture is there, or is all electroacupuncture PENS?
Truthfully, I mean, the only one that I know is PENS. Okay. The only people that have taught me, right, my mentors have taught me that that's what it is. I mean, I think there is just, you just shaking the needle inside of a muscle. Giving the stim inside of a muscle is a little bit different, but it's all about the hurt relation of what it's the stimulation of how fast it's going to be going, or vice versa, the hertz that it's going to be producing, and the release of different opiates within the blood system. So I don't think there's any difference between where it is and what it is, and it's all relative to the hertz that you're shooting out. And I think the quality of the unit, though, is big time. Some units can't even produce the right hertz that you should be using, vice versa, continuously. They're not as quality units. Like the $100, $200, $300 units are garbage.
Oh, okay. So just to recap, so TENS, if we compared TENS to PENS, TENS, you've got a pad on the skin. No matter where you put those pads, it's going to be called TENS. And with PENS, it's about the needle, and no matter where you put the needle, it's going to be termed PENS. So PENS doesn't mean it's a certain technique like you do the lumbar and the leg or something like that.
Well, think about it. It's pre-cutaneous, so it's under the skin.
Okay.
Where TENS is on the skin.
Okay. Yeah, great. Thanks for clarifying that. Will you walk us through a typical sciatic treatment? You touched on it earlier, but
yeah, for sure. I did touch a little bit on it earlier, but so obviously, I don't know if the listener knows this or vice versa, but especially when you're talking about a male client, if they come in and they have bilateral sciatic pain, a major thing that people do want to have that client get checked for is a prostate issue first, because you might be treating this person for sciatic pain when this person actually has prostate cancer. So
great tip.
it's bilateral usually, or even any sciatic pain. You always want to keep in mind that the prostate could be an issue. So that just off the start of it, always get into questions and ask, those typical questions about a prostate. Are you urinating right? Are you doing this stuff? But that being said, going forward with my treatment, like I said earlier, I usually drop needles, 2, 3-inch needles, 4-inch needles, depending on the size of the client, in. And I will go up as far as L2, L3, L4, L5, even S1, and I'll drop the jajis all the way in. And what I'll do, even though the sciatic runs between the L3, L4, I will drop on the whole area just to stimulate the entire area. And then what I'll do is I'll put a motor point on each GB30 on both sides.
Okay.
I always do this bilaterally. I know some practitioners will just treat the one side that's affected if it is only one side. But I usually do all my treatments bilaterally. I try not to uneven the body, bring too much energy or too much yang to one area versus too much yin to one area. I'm always going to do bilateral. So then I'll hook up clips. I'll get up to probably 8 pairs. I'll do one on the IT band around that, that GB 31, 32, 33. I'll find a nice Ashi point in there. And what I'll do is I'll go deep into there. If the person goes as far as right around, that will be my last motor point. But then I'll also do a thing called ihikon on the lower legs, which is from Kiko Masamoto. This isn't included. These do not get e-stim, these points, but they are always added into my e-stim treatment for sciatic pain. So what it will be is it's technically bladder 39.5. It's in the bladder 40 area, but it's more or less you go laterally, and it's all for touch. I usually find a nice tender, tight point. I'll go there and then I'll drop down to the bladder 58, put one there, and those are both with the flow. And then what I'll do is I'll go against the flow.
And at needle direction. Is that what you mean by with the flow?
Yes, needle direction. And then bladder 62 against the flow. And that's Kiko Masamoto. And it's called ihikon. And it is a great treatment for back pain. It's the ankle, the UB62 is for neck pain. The 58 is for the thoracic area, and then the 39.5 is for the low back, that sciatic pain. Typically, I think a lot of people, that empirical point UB40 is typically a low back pain point, or that sciatic nerve point. So, but in Japanese and Kiko, she states it as UB39.5. So she finds
a little lateral. Huh?
Yeah, it's more about palpations, which we've discussed is all about the palpations, and it's finding that where is that stagnant blood in there? Where is it? And get in with that needle, go with the flow and drain that out.
Yeah, so important to go for tender spots. That's where the chi and blood stagnated.
Exactly.
When do you cross the midline? Would you go from the JJs on one side to cross to the JJs to the other side, or do you go from one side to the motor?
Truthfully, I rarely do. I never, it's one of the biggest no-nos to cross the midline. But the only time I'll ever do is if I'm only dropping literally 2 needles in at L3, L4 at the sciatic nerve point, because that's where it crosses through there. I'll do one on each side and then one on each GB30. So those are just my 2 pairs, and my main points are at the L3, L4 Watto, and then my motor point is the GB30. And so those are just my two pairs. And then what I'll do is do one right above it at L2, L3. And at that point, that will be crossed. So it'll be 1, 2, 3. So those will be 3 pairs.
So I'm not sure I understand. So let's review. So if you've got JJ to L1 or L2 and
so I'll go right through it. All right. So think about it as if so there's technically going to be 4 needles in on the lumbar spine. It will be L2, L3,
okay,
and L3, L4.
okay.
So in between those 2 joints. All right.
And
so L2, L3, and L3, L4 in between those 2 joints.
Mm-hmm.
All right. So the top 2, so the L2, L3 is actually getting crossed.
Oh, okay.
All
so
right.
One's positive, one's negative on that.
Yes. And then think about it this way too. So now the L3 one and L3, L4 one is now going to be paired with the one on GB30 and vice versa. The other side is going to GB30. And you never want to have next to each other a positive, negative. So you always want to go black, red, red, black, black, red. You always want to be them when they're close to each other. You never want to have 2 reds next to each other or 2 blacks next to each other. You always want to keep the chi flowing differently.
So you'd go right, let's say right JJ to L3 to the right GB30, and then you do left JJ to L3 to the left GB30.
Yeah.
And then the left JJ to L3 and the right JJ to L3, they should be the opposite polarity.
Yes.
Okay, I got you. All right, great. Thanks for taking the time to explain that. AJ, boy, you threw out some gems there for our listener. I hope they appreciate all that.
Truthfully, that protocol right there is what I use on like almost every one of my clients if they come in with sciatic pain. And when I tell you it works, it works. Like there's people that have been saying that they've had sciatic pain for years or vice versa. They just went to a chiropractor for 6 months and got some relief here and there. And then they finally came to me and I cleared it up within a few treatments. I'll usually after that treatment, I'll take off and I'll do sliding cupping with fire cupping with deep massage with big cups all in that whole area and loosen pull that blood out. And, you within a week, usually the area is cleared up. If the person comes 2 or 3 times within the week, it's pretty much cleared up.
That's awesome, AJ. Yeah, you guys, the listeners can send checks to AJ for that electroacupuncture seminar. I'm actually
going to add one more thing in though.
Yeah.
So typically the first treatment I do, I'll do 2 to 5 hertz, continuous or intermittent depending, for 20 minutes. See how the person reacts from there. If the person reacts positively, I will go up to 2 to 10 hertz, 2 to 4 hertz, 5 to 100 hertz. I'll move up to see if we can even get more different chemicals in there, healing different processes. But there's one thing that a lot of people don't realize that, and even the medical doctors, the big gurus in the field can't really explain this. There is like a negative rebound effect to this stuff. Your patient might have a negative effect like 10 to 15 hours later after their first or second treatment. And you almost always want to actually let them know this ahead of time than actually going back and saying, oh, that was supposed to happen. Just go ahead and tell them that, listen, you ever hear that saying is sometimes you need to go backwards to get better. So there's that thing is just let them know that there is a possibility that there might be a little bit of a flare up. And that's just your body, almost saying us awakening, the flow of chi in the area and awakening the area to start healing itself. And sometimes you might get a little bit of a pain or a flare up of some sort. And just let them know that this is a possibility because you might get some people knocking down your door. You might get some nasty phone calls like, you SOB, you've made me worse. But if you let them know ahead of time and educate them on the process, it should be fine. And then you move forward from there and you'll usually get that 3rd and 4th treatment and you should be able to heal that person pretty quickly.
Thanks again, AJ. AJ, is there anything you want to tell the listeners before we go? And can you give them your contact info? Where can people learn more about you and what you do?
So you could find me at on Instagram at Acupuncturist on Fire, You could also find me at acupuncturistonfire@gmail.com. That's my direct email. I'm actually launching my own podcast soon, so you'll also get hop out and check out Eric on there talking about his Ashi acupuncture. Nothing else.
All right, AJ, thanks.
Peace.
We hope you've enjoyed this episode of the Ashi Acupuncture Podcast. We'd like to hear from you. If you have a question, topic idea, guest idea, or a particular technique you'd like to hear discussed on the show, contact us at our website, ashi-acupuncture.com. That's ashi-acupuncture.com.